Hello guys, today we are going to talk about APGAR score. We will first go through by definition, after that we assess how to do the APGAR score. Okay guys, first go for definition. It is a rapid scoring system that help the baby to evaluate the need for neonatal resuscitation. Each of parameter, there have 5 parameter, we can divide into 5. One is appearance and P is pulse, G is grimace and A is activity and R is respiration, and is assigned a score of 0 to 2, 0, 1 and 2, and it assess, first we assess on 1 minute, to assess 1 minute to determine that how baby tolerate the birthing process. And 5 minutes we assess that how well-being the baby after coming out mother's womb. After that we can go for assessment of APGAR score. It will be 0, 1 and 2. There have 5. First one is appearance, the second will pulse, the third one is grimace, and the fourth one is activity, and fifth one, the last will be respiration. Okay, first we will assess the appearance. So if the baby shows cyanotic, pale overall, it will be 0. If the baby shows peripheral cyanosis, only it will be 1. And if the baby shows pink all over body, it will be 2. After that we can go for pulse. If the pulse is 0, the score will be 0. If the pulse will less than 100, the score will be 1. If the pulse greater than 100, it will be 2. After that we can check the stimulation. We stimulate the baby and we check the response of the baby. If no response after stimulation, the score will be 0. And if there have grimace after stimulation, the score will be 1. If there have stimulation, the baby will cry, the score will be 2. We can check activity. If activity is absent, the score will be 0. If flex arm and legs, it will be 1. And if the baby is active, the score will be 2. Respiration we can check, and if the respiration is absent, the score will be 0. If the respiration is slow and irregular, the score will be 1. If the respiration is vigorous and cry, the score will be 2. After we assess the scoring, then we can go for management. If the score will 8 to 10, that shows the neonate there have cardiopulmonary, good cardiopulmonary adaptation. Good cardiopulmonary adaptation. And if the baby assess and the score will be 4 to 7, that need possibly resuscitation. Infant should be observed and stimulated and possibly given ventilatory support. Possibly given ventilatory support. If the 4 to 7, the baby need to ventilatory support. If the score will 0 to 3, that need immediate resuscitation. Like we need to do CPR, and we need to treatment symptomatic, and we can go for one case. Like if you are assessing the newborn, and the newborn body shows pink all over body, and heart rate is less than 80, and if you stimulate the baby and he shows grimace to stimulation, and after you check the activity, the arm is flexed and legs also, arm and flex and legs also, and you check the respiration is slow and irregular, crying. So this case is we can assess pink all over body is score will be 2, heart rate is less than 100, that is 80, that will be the score will be 1. And if you stimulate the baby and grimace to stimulation, that will be also 1. and if the baby is flexed and legs also flexed, arm and legs flexed, the score will be 1. And after that we check the respiration slow and irregular crying, the score will be 1. After that we count the score: 2 plus 1 3 plus 1 4 plus 1 5 plus 1 is 6. Total score is 6. So 6, we need to possibly resuscitate the infant and observe, possibly we given the ventilatory support, or we need to treat the symptomatic. Okay guys, this is the medical information video. If you want to take and if you want to do anything about it, you take the doctor advice. Thank you guys.